At the start of each day, the only thing you control is your attitude. A positive attitude affects your mental health, physical health, and those around you in a like manner. A negative attitude has the same effect on your health, mental and physical. With this in mind, you are the first link in the health of our community. Today I'm going to talk about the state of our community's health and how we can reduce chronic disease. I will talk about the components, the complexity, and the simplicity of moving from crisis to well-being, and most importantly, the role of each individual. The issue and importance of health has been with us through the centuries. In 500 BC, Buddha stated that every human being is the author of his or her own health. Ralph Waldo Emerson articulated the value of health, and Thomas Edison predicted the doctor of the future would practice prevention. But despite the message through the ages, in the United States today, we're not in very good shape. This chart shows the effect tobacco use, poor diet, little activity, and alcohol use are having on our lifespans. 38% of the causes of death listed are related in some way to personal choice. We are not doing well in Mobile County. Of the 67 counties in Alabama, Mobile is in the bottom 50% in 5 of 8 categories used to rank counties nationally. Unfortunately, this means we are one of the unhealthiest counties in one of the unhealthiest states in America. Where do we go from here? Healthcare professionals agree there are 3 components to community health: prevention, nutrition, and exercise. There are 3 numbers to remember: 50, 60, 70. 50% of all Americans have a chronic disease, yet 60 to 70% of these illnesses could be avoided by positive lifestyle choices. What are the elements of prevention, nutrition, and exercise? There are many obvious components to prevention, but the most important is providing hope to an individual to become motivated to seek the knowledge to make changes in their life. Vehicular safety is listed because Alabama has one of the worst per capita accident rates in the country, and the personal injury and property damage that results is often caused by drug or alcohol abuse. Again, an individual has to have a sense of hope to be motivated to obtain the knowledge to start eating better. There also should not be an economic barrier to good nutrition. Hope, again, is the key essential for someone to start a minimum exercise program. We also need the basic infrastructure of sidewalks and green space for people to enjoy the outdoors. Public safety also plays a key role in the motivation of people to step outside their homes. What is the correct model? Is it just talking about the linkage of prevention, nutrition, and exercise? Or is it a model of placing community health at the center of all policy and action within a community? Or is it a model of placing the individual and his or her relationships and sphere of influence at the center of action? Or perhaps is it this, at first glance a picture of confusion and chaos, but within this model lies the heart, which is the inseparable linkage of prevention, nutrition, and exercise. Aligned around this are the collaborative relationships and missions of every institution in our community, from leadership at all levels, government, business, community, to schools, churches, and social service organizations. The correct model is a holistic one that creates an environment that provides hope and motivates individuals to make the best lifestyle choices. So what can you do? Exercise, eat whole foods, get enough sleep, and nurture personal relationships. Be a positive influence in your family and with your neighbors. Get involved through any organization. Buy local produce. Each dollar spent drives the marketplace. You can change the world one bite at a time. At the end of the day, look back. Did you do anything to improve your own health or get involved in any way helping our community? If you did, good. If you didn't, tomorrow's another day. It can take weeks to change your body, but only a second to change your mind.